Welcome to the Staying Active podcast.
Welcome back to Staying Active with Dr. John Liss and me, Derek. We're talking skincare today, so that's fun. I am really excited about that because I am very Irish, which leads to quite a few sunburns. And as a result, I tend to wear a very large hat when I go outside. You know, I don't want those wrinkles and I don't want any skin cancer. So I've been sufficiently scared into the appropriate behavior. And so I'm hoping that you can either justify my choices or maybe talk me down a little bit today, John. What do you think?
Yeah, I think absolutely. I think that's we're going to get people comfortable with wearing sombreros along the spectrum of a sombrero. Maybe not so large, but I think it's a good idea overall.
Yes, my youngest calls it my lawnmower hat, and it's really just a giant fishing hat that I wear while lawn mowing. So it works out. He's got one too now, so we're twins. We ride the mower together. It works out. Everyone's practicing safe sun sort of measures here. Everybody's doing well. So I guess that's probably a decent lead into, you know, some of the things that I'm obviously concerned / curious about. But just in that realm, one of the things that I hear all the time, and I don't know, it seems to come and go every few years, but people seem to be really scared of sunscreen sometimes. Have you heard that before? Is that like a thing that comes to you in the clinical setting?
Yeah, and so it's yes, short answer, yes. It it really does. Like I guess before, like we should definitely touch on that because it's really important to
Sure.
to comment on. I would say before, just to take a brief step back, is
Yeah.
sun exposure in general. You know, we are, as humans, we're supposed to be outdoors evolutionarily, have been outdoors, and some sun exposure is very good, right? It's how we synthesize vitamin D, which is very useful for, you know, bone health and metabolism and a lot of other things. But there's a limit, right? And people with paler skin tones, like people of Irish descent, such as yourself, um, don't have as much what we call melanin in the skin, which is a sort of a pigment that helps to protect the skin from sun damage. And so there's a variety of grading of various skin types, from very, very light to very, very dark. But nonetheless, regardless of your skin type, yes, it is a little bit harder to have the sun damage your skin if you have a very dark skin, but still possible, of course. The sun in too much, after about maybe 20 minutes of exposure or so, starts to damage the skin. And so it's really the UVA and UVB radiation, ultraviolet light, that kind of penetrates through and disrupts the DNA in your cells, really. And that's what a sunburn is when you have too much of that damage that accumulates. Those cells are like, you know what, I'm out. Piece of accumulated too much damage. I'm dying. And the cells die. And the sunburn is your body's response to DNA damage from the sun. That's how you know you've clearly gotten too much. And so there are two ways, well, really three ways, to protect yourself from sunlight. One is to avoid sunlight by either staying indoors or staying in the shade or covering up with like a sombrero or longer sleeves or things like that. But the other two ways involve types of sunscreen. And so there's two types of sunscreen that exist. There are the mineral sunscreens, and these are things where the active ingredient is something like zinc oxide or titanium dioxide. Typically, these are the ones, like if you ever watched a movie with the lifeguards and they have the big white thing on their nose, that's a mineral sunscreen. It does not rub in so easily, and it works by just reflecting the sun's rays kind of right back out into the ether.
Sure.
The other type are what we call chemical sunscreens, and these blend a little bit more easily into the skin, so you don't look like a ghost necessarily wearing these. And so things like avobenzone, oxybenzone, there's a few others of these, but they're called chemical sunscreens. What they do is they absorb the sun's energy and they just basically give off heat as a response. The controversy and what you're describing of like people like, no, don't wear sunscreen, and I think Tom Brady's don't quote me on that, but I'm fairly certain he's a celebrity proponent of no sunscreen. The controversy is that, we've seen melanoma rates, which is a type of skin cancer, is really aggressive skin cancer, really accelerate in recent years, kind of correlating to when we've started recommending sunscreen use. But it's sort of a red herring in a sense. It's not a causal arrow. And so every dermatology association across the globe absolutely recommends sunscreen use. Perhaps there are some dermatologists who say, yeah, maybe I'd rather have you have a mineral sunscreen as opposed to a chemical sunscreen. But some sunscreen is better than none, especially if you're going to be outside for more than 30 minutes in like, kind of from the 10 a.m. to maybe 4 p.m. Window of time when the sun is most intense. And so that is, we know beyond a shadow of a doubt that sunscreen use reduces melanoma rates, reduces other types of skin cancers like squamous cell and basal cell. It reduces wrinkles. It reduces things that are precancerous called actinic keratoses. And so all in all, a good thing. And the last thing I'll say before I shut up, because I've been rambling a little bit, is that, some of the people who are like proponents of no sunscreen are like, well, the cavemen never had sunscreen. They were, the Neanderthals never, Homo sapiens never needed sunscreen. Well, two things. One is that they tended to die much earlier for a variety of other reasons. And two is they weren't like directly out in the sun all day long. And the types of Homo sapiens that were the ones kind of on the African subcontinent developed an adaptation of more melanin in the skin. So it's there two are not the facts that, like, yes, we need sunscreen now and like we didn't use it in the past are not reasons to, are not like there's no cognitive dissonance there. It absolutely makes sense. So I'll shut up there.
Well, it's interesting for you to bring up the concept of a red herring there, just kind of being like something that people point to and use as the like, oh, this must be causal. That's really interesting to know that there's kind of a root source to some of that. What I wanted to touch on a little bit more is you had mentioned like a limit of sun, and you touched on, about 20 to 30 minutes at a time. I don't know if this is like nitpicking your language or not, but just for clarity, so say you're out for 20 minutes, 30 minutes, you're not wearing sunscreen, whatever the case is. You go in the house for 10 minutes and then you go back out. Is there some sort of like recognized reset moment, or is this more of like a cumulative stress sort of situation?
That's a really good question. I'm glad you brought that up. It is cumulative over the course of typically of a day. I would say would be the safer option. Like if you have 20 minutes of direct sunlight and then you go in for 10 minutes and you come back out and you get another 20 minutes and go back, like that's too short of a time period to kind of serve as a reset. The safest would be like an overnight, several hours at least.
Got it.
Of no sun exposure. But typically, there are even some dermatologic associations that recommend a daily low SPF sunscreen regardless, even if you're indoors most of the time, because there is some UV radiation as well. But if you don't want to be slathering sunscreen on your face every day, a lot of the daily moisturizers have it anyways, have SPF in it. But to add clarity to your question, it is typically more of a cumulative over the course of a day sun exposure.
Sure. So I'm not going to stay on sun exposure the entire time. It's just something, I thought was topical given we're finally getting some good weather here in Connecticut. So I figured I'd get some of these questions out of the way early, but I have a few others as well. But
sure,
just to double up on it, I know some of the things that you talked about is like wrinkles. I've read quite a bit about not just necessarily the DNA, but like the RNA being damaged in the skin, from long-term sun exposure, and ending up with like a thickening of the skin. Which ultimately ends up leading to like some of the wrinkles or like the harshness, like kind of beating up the skin. I can't help but feel like it reminds me of something a little bit. We talked a little bit about rhabdomyosis at one point, and it's just so interesting how like acute stress causes like damage to the protein at such a degree that it's like almost irreversible. And that's just like I don't know. And I'm not saying that it's irreversible or any of that. I'm not trying to make claims that I don't fully understand. It's just it was close enough to me where I was like, oh, that's really interesting. It's a lot like, sun is good for you, but too much is not great for you. Exercise is good for you. Too much is pretty bad for you.
Yeah.
It was just interesting to see kind of the parallels.
Yeah, that's exactly right, and it goes back to the maxim of the dose maketh the poison. I
Yeah,
would say from the sun exposure example, the dose is much lower to cause harm. From the exercise example, most people won't exercise themselves into
sure. Yeah.
rhabdo. They could, but
I mean, hopefully they don't.
hopefully they don't. But you're absolutely right. That principle broadly applies. I think probably across virtually everything that we'll talk about over the course of the podcast.
Mm-hmm. So one of the things that comes up quite often is, especially in the fitness space, people are trying to, eat well and look good, and they, summer comes around, they're trying to get their summer body, and they, you know, inevitably people bring up tanning, and it always seems to be interesting to me that people talk about like a base layer of tanning, and I don't know enough about this to know if it's like makes no sense or not. And maybe this is just my own ignorance, and that's fine, I suppose. But what about like tanning beds to establish this like base to then like go out and essentially cook yourself? Like what's the logic behind that, and does that make any sense?
So that's a great question. So I think the underlying logic sort of
Okay.
makes sense when you think about adaptation. The body is
Sure.
pretty good about adapting to a stressor and responding in such a way that the next time it encounters that stressor, it's ready for it, plus some. And so that's really what, when folks of our kind of skin tone go outside, mainly of Polish ancestry, so I'm, about as pale as they come. uh, this sort of, yes, I'll get a little bit tanner perhaps over the course of the summer, and that's my body's attempt to, produce a little bit more melanin to protect my cells from sun damage. Um, that is, that adaptation is somewhat slow, and it is still like I'm never going to get to the point really where my skin kind of naturally protects me from really harsh all the time sunlight.
Mm.
When people mention like kind of a base tan, I think typically what they're referring to is like, yes, I'm a little bit tanner than when I started, and therefore I'm a little bit more resilient to sun exposure. But that's not a reason not to still abide by the exact same rules of sunscreen, the exact same rules of avoiding overexposure in the sun. Um, and as far as tanning beds go, that is, full stop. No, don't do that.
Oh, really?
Yeah, artificial tanning from UV radiation from tanning beds has been linked is pretty strongly linked to increased risk of basal cell carcinoma, squamous cell carcinoma, melanoma, and many states, in fact, years ago banned it for teenagers and minors, essentially,
Oh,
due to that
interesting.
reason, because the social pressure to tan was quite high. They were, overdoing it certainly and really accelerating sun damage and skin cancers. But that's basically in my mind, what a tanning bed is. It's a cancer accelerator. And so it is something I absolutely do not recommend and actively recommend against, even if it's to establish a quote unquote base tan. Um, I think that is an easy harm to avoid.
Yeah, sounds like it.
And there are other options too. Like there are like topical bronzers and like spray tans. If people wanted to go to an event and look tanner because of the aesthetic,
Sure.
fine. Like a topical thing is far less likely to. Although there are certainly a lot of chemicals in that. You're not sure. Who knows what they're spraying on you? Um, but the effect is shorter lived. And so in terms of harm reduction, it's likely less harmful. But best practice is just to avoid those types of things altogether.
Well, maybe that's a good segue. I've heard a lot of different things about this, but like permeability of your epidermis of your skin. How much of what you put on your skin really matters. Like, I'm sure the term absorb is incorrect, but I think people will understand what I'm getting at. How much of that matters? and how careful should people be with their selection of whether it's lotion or whether it's something like sunscreen or something like that? How careful should people be?
So that's a fantastic question. People may know from trivia or from, I don't know, watching Jeopardy that the skin is the largest organ in the body, considered the largest organ in the body. And actually, the outer layer of the skin is dead. It's dead skin cells that kind of stack up, thicker in like palms and soles, thinner in areas like, your elbow or your face, genitals. But it does absorb things, right? The skin absolutely does absorb what you put on it. However, it's typically not. It's quite difficult, in fact, to have something absorb into the skin in such a way that it affects you systemically. And so, two examples of that are, one is a drug that's called Voltaren gel, and it's a topical anti-inflammatory. And even people with really severe kidney disease, it's a type of NSAID. Even people with really severe kidney disease can use this even on pretty large joints. Like it works well on smaller joints, but you can use it on a knee and not have to worry really at all about systemic absorption in a significant way. Like, yes, some is, but it's pretty minute.
That's cool.
So most topical things, lotions, sunscreens, Voltaren gel, steroid creams for things like psoriasis or poison ivy, I wouldn't think twice about using those and the systemic effect. If it was like a mercury ester that you were working with in a lab and like your glove broke and you got a drop of it on your finger, yeah, you might die in 24 hours, but that's a very extreme chemical example. But that's by and large from anything you're encountering sort of over the counter or that your prescriber is giving to you prescription wise. The vast majority of them do not have systemic absorption. I will say perhaps the exceptions to the rule include like topical testosterone therapy, if that's how your prescriber has given that to you. That's probably the big one that's absorbed fairly well systemically. But most of the things we're talking about from a skincare perspective, I wouldn't think twice about.
Okay. I think that's probably something that I'll want to dig in on another episode because that's fascinating. I would love to know the driving mechanism from one thing to another, but that's my own.
So would I.
Yeah, that's my own curiosity, just like, ooh, I gotta know that. So, all right, so let's shift a little bit away from like sun exposure and things like that because we can very easily just kind of like fall down the like cancer rabbit hole here.
Right.
And I mostly just, want people to understand risks and what they should be doing about it. And it does appear that like common knowledge will prevail here. And that you should consider yourself safe except for extreme examples with regards to what your skin is capable of absorbing. So that's great. And I think we can put a little bow on that and talk a little bit more about like what are some like common issues that you see clinically with regards to people's skin and just overall health.
Yeah, so it's a good question. Typically, the skin is sort of a window to someone's overall health, and we'll find that people who are healthier tend to have better skin condition, better elasticity, less wrinkles, things like that. So, in fact, there are some startups now that have pretty good data looking at they're doing like sort of facial scan over the course of somebody's sort of cancer treatment and using that to predict their survival. In fact, the people with worsening facial features tend to do worse and have worse survival. So it's an interesting field. But the common things that we see from a primary care perspective, most of the things from skin, it's either like an allergic exposure or some sort of exposure like insect bite, bug bite. Poison ivy is a big one that we see this time of year. Rashes from things like tick bites and things like that, which we see, not uncommonly, but typically kind of like the red rashes that are kind of short-lived and itchy kind of stuff. There are also ones that are kind of more red, hot, inflamed, painful, things like cellulitis, which is an infection of the dermis, which is kind of the alive layer of the skin underneath that dead layer. And that can progress and be serious. And so sometimes we'll have to treat that with pills, with antibiotic pills or IV. And then there's all sorts of kind of autoimmune, along the autoimmune spectrum, things like psoriasis, things like eczema, things like, psoriatic arthritis is kind of on that spectrum too. There's a lot of things along that sort of spectrum. That different vasculitis, although that's somewhat rare. It's interesting because like diagnosing of dermatologic conditions and what a lot of the dermatologists who are really good, it's pattern recognition. And so yes, they take some of the clinical history into account. You have to unequivocally, but knowing if something is seeing the appearance of something, they can almost tell you what it is in a half second. But diving down and knowing how to describe a lesion, and kind of describing it to, if you're going in as a patient, how do you describe this to your doc? Is okay. How long has it been there for? Is it flat or is it raised? Is there one of them or are there multiple of them? Are they do they have any sort of scale on top or not? Is there sort of like a middle dent or not? How large is it? Has it been growing or shrinking over time? And then have you been exposed to anything new, like, been hiking in the woods or doing yard work or a new medication or a new dish detergent or something? Kind of good places to start. It's tough to, I have patients all the time, they'll send me photos of their rashes and be like, is this concerning? Is this not concerning? It's very hard to take like a good photo, even with the like modern cell phones. So typically we ask people to come in just because it's a lot easier to see, unless a patient is just very good at taking a photo. But yeah, those are kind of the more common things we see. Most of them can be treated as sort of topically or with a simple kind of pill for the vast majority of these common things that we see. But beyond that, we'll obviously get people to dermatologists if there's a concern for skin cancer, which is another fairly common thing that we see.
Sure. And so it sounds like what you were saying is a significant amount of this is like what I think what you said directly was pattern recognition. So all of those little things help help a physician identify, okay, likelihood as well as what it actually looks like, and as well as like the symptom profile. So that's good to know that it's not as cut and dry as like, yeah, we'll just scrape this thing off and test it, right? It's a lot
Right.
of, let's I don't want to say take a guess, but you're kind of putting some things together
Right.
to come to a reasonable solution here. So how about things like moles, freckles, things like that? I haven't gotten one recently, and tisk, shame on me. But typically when I get my when I get my physical, my physician will do like a quick once over about skin stuff, and just like check moles and things like that. And it's usually a pretty quick portion, but what's going on there? What are we looking for, and why does it matter?
Good question. The binary of what we're looking for is there a skin cancer or is there not a skin cancer? That's really the big deal
Great.
there.
Nice.
Things that have been there forever on your skin, if you're like, oh, thing's been there forever, even if it looks funky, if it's been there forever, it is very unlikely to be something dangerous or skin cancer. Even if you have a lot of, kind of dark moles or things like that, if they all kind of look similar and scattered across the body, again, they're very unlikely to be something like skin cancer. Um, the common things, especially if people live longer, are these things that look like someone chewed up a brown piece of gum and sort of stuck it on the skin. That is completely benign, but patients all the time get worried about those. They're called seborrheic keratoses. They're entirely benign. They're more common as people live longer, but they're kind of like the larger, darker, raised moles. And those are totally fine. But the things that we really look out for, and actually, interestingly, one of the signs that dermatologists use and when we use in primary care is called the ugly duckling sign. So if there's something that's new and different, doesn't look like it belongs there, looks kind of, strange in the field of other moles, that's something we'll focus on. So kind of just the gestalt of, okay, is there an ugly duckling present or not? But specifically the criteria that we're looking at, and people can, can kind of keep an eye on these types of things at home, is called ABCDE. It's the first 5 letters of the alphabet. It's a acronym that stands A is asymmetry. So if the lesion is like perfectly circular or like perfectly oval, that kind of thing, symmetrical, really not a big deal. If it's kind of like got one side that's like squiggly and then the other side looks like a big blob and it looks like a peninsula, probably not a great thing. B is for border irregularity. So if the borders are nice and well circumscribed, like, this is the lesion, this is not the lesion, there's a border there, very clear. If it's like, I don't know. It kind of blends into the area and it's kind of gradual, and maybe like the border is good here, but then it kind of drops off here. That is a red flag. C is color. So if the color is again like the same color throughout, no problem. If it's got little patches and there's a lighter part and a darker part and kind of like a wavy part, that's not great. D is diameter, and so just like of a certain size. So anything that's sort of like larger than like a pencil eraser, maybe even slightly larger than that, like, approaching dime size is like, okay, we really start to get really worried of these larger kind of lesions. And then E is the most important one. That's evolution. So that's whether it's changed over time. So again, like if there's something that's been there forever, not a big deal. But if it's like, oh yeah, that's all of a sudden new, and it seems to be kind of growing and shifting over time, like even over the last month or so, it looks kind of different. Definitely a reason to call your provider and get seen for that.
So the A, B, C, D, E rule, very easy to remember like that. Would that be something like any of those be a reason to call your provider and try to schedule something pretty quickly?
Yep, absolutely.
All right.
The E again, the most important one.
Sure.
But these are actually a photo is a little bit easier for these types of things to be able to see and determine. So you can always do that if your practice is set up in such a way to accept the photographs. But
Okay.
Definitely a reason, I would say, if you have A, B, C, D, E, certainly more than one of each. If you meet more than one criteria, it's definitely a reason to contact your doc.
Okay. I guess last part about this is how frequently should an adult be seeing a dermatologist? Is there a regularity that just should happen, or is this kind of a specialty field? What do you think about that?
This is a great question. I get this question a lot. Do I need to see a dermatologist? And in most cases, if you have no strong family history of skin cancer, if you're pretty diligent about sun exposure, if you're coming in at least annually for a skin check from me, you don't need to see a dermatologist annually. Even the people who I have sent to dermatologists for kind of like annual skin checks have started to push out patients to like every 2 years, maybe even every 3 years for a skin check as opposed to annually. And therefore, like if you're seeing your primary care for a physical, kind of fairly comprehensive skin check once a year to get, even like if it's like, oh, this looks weird, that's an ugly duckling, but I'm not sure what it is, let's send you to derm. Like even that sort of triage is really useful. But most of my patients, again, if they're like average risk, I don't feel strongly that they need to see dermatology. A, it's hard to get in with a dermatologist anyways. It kind of gums up the system. But B, you're not really getting that much more if you're completely asymptomatic and your skin looks good. If you do have significant family history of skin cancer, if you have a personal history of skin cancer, or if there are any kind of odd or atypical findings on the skin, whether it's cancer or not, those are the patients that I'll send to dermatology. Absolutely.
Okay, great. You had mentioned a couple of things earlier that kind of just grouped into the family of like autoimmune conditions, and it kind of just triggered me for some things to think about, which is mostly just like dry skin, eczema, irritation. They all seem to have like inroads to each other, right? And I've always found myself kind of like unsure how to determine one or the other. Not that it's my responsibility to, but it's like why do so many autoimmune conditions come with skin irritation? I mean, I understand that they are inflammatory in nature,
Yes.
but if the outer layer of skin is dead, why what's going on there?
Yeah, well, in those cases, it's typically affecting the dermis underneath, and so you do have irritation, inflammation, kind of in the active and alive cell layers. But it really goes down to you kind of hit the nail on the head there. Is these are typically inflammatory conditions, and anytime that the skin is inflamed, there are a lot of various cytokines and cells that aren't normally there in a kind of a big immune response. And that kind of big immune response is the same type of thing that we see when there's a sort of like a bad player on the skin, like poison ivy or something like that. So
Yeah.
it is very common that any type of skin inflammation will lead to itching. And itching is such a non-specific symptom. Almost anything can cause it. But luckily it's pretty treatable. And even if docs don't know what's going on, most of the time a topical steroid, and there are various strengths of these, but most of the time a topical steroid will kind of nip it in the bud.
Mm.
In the majority of cases. So even though sometimes like I'm like, well, I'm not sure what that is. It looks like a non-specific dermatitis, right? Inflammation of the skin. Not really sure what's causing it. I went through the full
Yeah.
history. I don't really know. But there's nothing dangerous there. So let's give you some topical steroids, and they use it for a week and it goes away. So,
Okay.
but you actually were you're kind of spot on with causative there.
Well, that's great. I like when I stumble into being correct. Um, so sticking it with like some of these constants and just, poking holes, doing what I do. So examples of people having sensitivities of the skin,
Hmm.
right? So we're not talking about mercury, thank God. Don't play with mercury. Uh but we're not talking about like, testosterone creams or any of these like extreme issues. Somebody who is sensitive to a certain type of like detergent, right? I'm a
Hmm.
good example, right? I'm a big wuss. I cannot use regular detergent. I
Hmm.
use the free and clear.
Yeah.
John, what's wrong with me?
So basically what's happened is you've developed the fancy term for that is you've developed what's called a type 4 hypersensitivity reaction, which is sort of there's four different types of allergic reactions, and this one
Mm,
basically is an overreaction of your system to a foreign object on the skin, and that's the molecules of the detergent you're using. Um,
how lucky
Fragrance,
and fun.
yeah, like it's actually pretty darn common. Poison ivy is a type of this, but there are
Yep.
also like various types of nickel and like nickel plated jewelry or belt buckles is very common to do this. Certain detergents and fragrances very common to do this. Certain shampoos and hair dyes very common to do this. In fact, there was a meme I saw online this a few months ago, but a person who had done hair dye and they put like a cap on for their hair dye, and then all of a sudden they took it out and their entire head was just giant and inflamed because of they look like a Squidward almost.
Oh,
um,
nice.
and so that again pretty common, but and who knows why that your body kind of responds that way to that chemical, because a lot of people don't, right?
Yeah.
um, but it's essentially your body kind of overreacting. um, and each time, typically, the interesting thing about type 4 hypersensitivity reactions like poison ivy or like contact dermatitis from nickel or from detergent
Sure.
is typically each exposure, actually the response gets worse and more exaggerated. So it's not like you can like really necessarily wean yourself off over time by like repeated exposure in like
Yeah.
some allergic type things. Um, this typically tends to get worse the more you are exposed to it. So
That's so
um,
interesting.
yeah, so the free and clear detergents are, luckily they exist and a lot of people use them. Um, and avoiding like jewelry. Actually, gold is one of the least. If you're curious about what jewelry you should be wearing, gold is typically the least, platinum as well, but the really expensive ones are kind of the least likely to cause allergic
The
reactions
good
on the
stuff.
skin. So another reason to buy gold other than the price, I think, is off the charts. But anyways, I digress.
This isn't an investment podcast, John. You
No,
keep it
please.
keep it to yourself. Uh, the that's interesting. You answered several questions that I had there just about like common irritants and things like that. It with the variability of people, it does make me think that it must be like I don't want to like tie it to gut health, but like microbes to some degree, right? Such high variability and having just such an inconsistency across people. I would think like, well, what's one of the more highly variable things about people is like, different types of microbes that they're exposed to over their lifetime. That's really interesting. Maybe we'll talk about that one day.
Yeah.
Um, so interesting. I was really curious about that. Hot showers, another one, hot showers really making people's skin angry, from what I understand. What's going on there?
It sort of just dries you out essentially, as any type of like prolonged heat
Yeah.
exposure the skin doesn't like it. It's not necessarily causing the same level of damage as a sunburn is, but over time it sort of just causes local inflammation, irritation,
Oh,
can
interesting.
can sort of chronically dry out the skin, in fact, which then can cause itself um, itching and dry skin. Um, Pruritus really. So really hot showers is, it feels good, like in the moment, right? Um, but trying to limit it so it's not kind of scalding. That's often an easy fix, in fact, if people have kind of more like systemic, like dry, itchy skin, is just lower the temperature of the water just a little bit. You can still be comfortable, uh, but try not to scald yourself uh, in the shower.
That's yeah. It's a tough one for me as well. This is actually an entire podcast about convincing me to stop doing all the things I'm doing. All right, one not for me. One not for me, I promise.
Yeah.
So, really hyped up. I know that this is a particular area that you're like really interested and pretty invested in. I won't say names because I don't want anybody to get the wrong idea. Um, Anti-aging sorts of treatments and claims, all these, you've got special diets, you've got, special supplements and drugs, and of course you've got things like retinol and anti-aging creams and things like that. I'm sure some of this is broadly good for you, cleansers, things like that, normal things that you would use to like wash your face, take care of your skin. You know, um, how much of this is just nonsense, though?
That's a good question. I will start by saying that the best skincare routine that you can have is being systemically healthy. So if you're unhealthy, you're not exercising, you're eating like crap, you're sleeping like crap, your skin's going to reflect that. So the best way to help your skin is to exercise, eat right, sleep well, unequivocally, beyond a shadow of a doubt. There are a few things though that help from the standpoint of, if we're talking about anti-aging, a lot of the, it's not like we can necessarily turn back the clock on the skin, but we can have the appearance of like a more youthful appearance. And so there are a few things that do that, typically via wrinkle reduction. And so retinol is sort of on the spectrum of vitamin A derivatives.
Okay.
Retinol is available over the counter, and sort of weak. But the tretinoin, which is a topical, actually was made as an acne treatment, but it comes in various strengths. But tretinoin topical cream has actually been shown beyond a shadow of a doubt to significantly improve appearance of wrinkles over time. And so that is something that I have patients use as long as they're not pregnant. That is typically more than okay for them to use. Side effects of that, though, sometimes it can be really irritating to the skin, and you'll get kind of skin flaking. So we start people off on the lowest dose, and we'll have them do maybe every other day or every third day to start. But that one is, if people are concerned about wrinkles and crow's feet and things like that as they're aging, the tretinoin topicals actually have pretty good data behind them. We start to then get a little bit more murky. People sometimes use Botox, which is botulinum toxin injections, which kind of just allow it's wrinkle reduction because you're not moving your face. So like there's no stress to the face, the skin of the face. And it wears off after a period of time. So you kind of have to redo it. It's expensive. It's not the most comfortable thing to have done because it involves needles. Some people will do that, but again, it's sort of a temporary fix, so to speak. But that's pretty popular in terms of like modern pop culture. The other two things, like a daily moisturizer and a cleanser, yeah, probably not a bad idea to keep your face relatively clean and well hydrated, but it's not. Those things aren't going to make a huge difference in terms of like the overall appearance of your skin as much as being healthy and tretinoin will. So there are all sorts of different types, and people will say, oh, my thing has ceramides and mine has beet extract and mine has who knows, and a lot of that's kind of snake oil. Like, okay, let's just calm down. And like a bottle of CeraVe, which you can get for $6 at Walmart, is probably equivalent to those in terms of moisturizers. The last thing that has maybe some preliminary data behind it is a vitamin C serum, which is such a trigger word to me, the word serum, because it's like almost invokes snake oil. There are a few that are that dermatologists like better than others. I'm not going to name names on brands, but a kind of rule of thumb is if it smells like really terrible, it's probably a better product. which is weird. Just because like in order to have like really good stability of like the active component of vitamin C, it smells terrible. So people will put this on their face and their face stinks. So do it at night if you're going to do it. Is the PSA. But
Nice.
so like, from my own standpoint, I've used tretinoin in the past. I recommended by a dermatologist friend of mine who's a Mohs surgeon in the city. And I got really bad skin irritation within like a week of using it. So like, flaky kind of facial skin. I was like, you know what, that's not for me. So I just tried now to focus on being as healthy as I can from a skincare perspective. The last thing just to mention is fillers are also somewhat popular. That's injection of kind of a polymer underneath the skin to add depth and add volume to certain parts of the face. Not typically something I recommend because these things are actually typically fairly permanent, and your body can kind of resorb these in weird ways, and so like down the line, there's typically some sort of complication or like your look changes in a significant way.
Mm.
So I try to tell people to avoid fillers if they can.
Okay. I only have really like one more topic in line with this to go through. Thanks for being so thorough on that. So that's let me move on here. This isn't necessarily a like a podcast for kids. If kids are interested in health, that's cool. Let's go. But I do want to take care of parents to some degree, and so maintaining some of that information. I can't get out of my head one of the early things you said, which was whether or not this is verbatim or not, I apologize, but the way your skin looks and behaves is a window to your health, right? That's
Right.
something you were talking about early on. And I'm
Yes.
like, oh, that's really interesting because when I think about baseline who is just naturally healthy, I think about, kids are because they're growing, they're building more cells than are dying, and as a result they're just like constantly recovering from things, right? It's really hard to keep kids down. They're just like constantly improving, their bodies are constantly just like, fixing things, making new things, like that's great. So of course, now I sit here and think like, well, what about when kids have like skin problems, when they've got like rashes that are constantly coming up, when they've got things like eczema or some of these like raised, more like flaking style abrasions. Is that something that a parent should be concerned about?
So it's interesting. It's in kids, and I'm not a pediatrician, just for full disclosure,
For
but
sure.
if in kids, those types of conditions, like especially eczema, is actually pretty darn common, and it doesn't mean that your
Really?
child is like systemically ill. Eczema is pretty common. Various rashes of sorts, like pretty much every viral illness that a kid can get, can have the potential to include a rash.
Sure.
And so they're typically more transient, but things like eczema are actually pretty darn flaking, pretty darn common in kids, and not an indication necessarily that they're systemically unhealthy or that there's
Okay.
something, a
That's good
red
to know.
flag kind of brewing under the surface. But it's if typically in kids, if there's just a rash there that's you can typically keep an eye on these for a few days if the kid's not bothered by it. But if it's persisting, or certainly if it's really itchy or painful, that's a reason to to see the pediatrician and just take photos of it, just to show the progression to the
Hmm.
pediatrician is always helpful. Um, but from really the best thing you can do for your kids is getting them a lawn mowing hat like your kids have. Like just get them a goofy looking sombrero for like especially around the summer, the beach, if they're outside playing around. Really helpful from that standpoint. Making sure you're reapplying mineral sunscreen is kind of typically recommended by the pediatricians, but any sunscreen again is better than none. And doing that kind of every 2 hours if they're having constant sun exposure is a general principle. And a lot of actually a lot of the skin cancer data comes out of Australia because they have Western Australia in particular has really high rates of skin cancer. And so like bathing suits or things like that, if people are outside the summer, their kids are outside, they make long sleeve, bathing suit tops and things like that, have a little bit more coverage for your kids so that they're, if they're screaming and kicking and fighting, trying to reapply the sunscreen, but who's experienced that? Then at least, they have some coverage from a clothing standpoint.
Okay, very cool. I got a couple of rapid fire ones for you. So thanks
Hit
for
me.
that. All right. Couple of scenarios,
Yep.
the patient walks in, they're saying stuff to you. You got to make a decision quick, right?
Yep.
And if hey, we got to talk about this more, that's fine. All right. Hey, I got a mole. It's probably nothing, should I come in?
Yeah, that's a hard rapid fire question because the answer kind of it
Aha.
depends. The answer is kind of it depends. I would say if it's like a rapid fire and they're like, kind of equivocal, show me a picture. Send me a picture. That would be
That's
my
great.
answer. I want to see it, but you may not need to come in.
That's perfect. That's
Mhm.
an ideal answer. I like that. All right. Hey, I don't really need sunscreen. I only burn once each summer. It's totally fine.
It's not totally fine. Each burn significantly increases your risk for cancer down the line. Please don't burn or get a base burn, or that's a terrible idea, a burn of any sort. So you absolutely do need sunscreen, or if you're not using sunscreen, you got to wear loose-fitting long sleeves, long pants where you're keeping cool, but also covering your skin.
I don't need sunscreen though because I tan really easy.
Yep, that's it's still a myth. Even people with really dark skin tones can still sunburn, and still can accumulate damage under the surface. That's tough to see unless you have kind of special cameras. So, still a very good idea, even if you tan easily, even if you have darker skin types. Absolutely, still a good idea.
My skin's always really dry. It doesn't matter what I do to it. What should I do?
You should drink more water to ensure that your urine is clear to faintly yellow in color. You should apply a emollient lotion like a CeraVe unscented lotion over any area that is dry. And if it's still really dry, the kind of your bed sheets will hate you for this, but applying petroleum jelly or kind of Vaseline Aquaphor, the really thick, goopy ointment stuff over any dry areas will unequivocally help. And if that's not helping, see your doctor or your dermatologist because there might be something under the surface.
That's great, John. Thanks for taking the time today. That was awesome.
Nice.
You got any closing words for us?
Wear sunscreen, wear a big hat, and yeah, that's really it.
It's lawnmower hat summer, people. You heard it here.
Hashtag lawnmower hat summer.
That's right. All right. Thanks, John. I appreciate it.
Anytime. Good chatting with you as always.